When I'm outside, if I walk to the mailbox, I get tired. I gotta stop like 2 or 3 times before I get where I'm going.
Walking 100 feet, would be like running, half marathon, comparable, just real winded, real out of breath.
Ever since I met him, he's been a great doctor. He's been so great.
Her heart had gotten weaker. The pumping function wasn't what it used to be. Right? Everybody has extra beats, but to have them that frequently is rare. We discussed trying medicines first, and they just didn't work. Sometimes they do, sometimes they don't. And it was a pretty sudden change.
Heart surgery is not always open heart surgery. They could do it through your veins and your arteries.
She was awake, so we start off by just asking her questions like what would make her comfortable.
Not every procedure is awake. Hers is an exception, and most of them we don't do awake, so she was an exception. The technology's amazing. And then we have navigation systems, which you don't really see. That's a lot of software kind of behind the scenes, but that can help us create a 3D map of the heart and then use a GPS system to kind of know where we've been and where we need to go to. We actually have to create damage to the heart to get rid of that extra chunk of cells or the extra electrical connection. We actually heat up the tissue and destroy millimeters of tissue, but at the right spot can get rid of that connection.
Since I had this procedure, I had no problems. I had no chest pains, been just out of breath and tired and all that. I'm not 100%, but I'm better than what I used to be.
It makes us feel good. It makes us feel like, we did our job really well, and it makes it worthwhile.
I saw her the next day, and she was so thankful that, everyone was so nice to her, and it was still too early to know, how well would she do. And then when I saw her several weeks later in follow-up, and then she was just, you know her personality. She was all smiles and just ecstatic. I can do all this that I used to do and had to stop. Yeah, she was so happy. It felt really good. But it's nice to hear it when patients say it and ask for it. That it's a lot of job satisfaction.